Hello, my name is Kelly Cavallio, and I'm here to present Securus, a safe opioid disposal product. I'd like to introduce Team 6, comprised of myself, William, Taylor, Adam, and Diane. In 2015, the amount of opioids prescribed in the U.S. was enough for every American to be medicated around the clock for 3 weeks. The U.S. is in a national opioid epidemic. Opioids are killing Americans in alarming numbers. Unfortunately, medicine cabinets are easy access for those who are seeking to misuse drugs. Currently, there's no easy way for these medications to be disposed of and not damage the environment. Securus has a significant opportunity in this market. Securus offers a safe opioid deactivation solution. This simple kit would allow for the safe disposal of unused opioid medications. It offers solutions for the pharmaceutical industry. It offers patients safe disposal. It offers the environment a friendly way to dispose of these medications without harming the water systems and the overall environment. And finally, healthcare and healthcare providers can offer this to both patients as well as dispose of these drugs for their own use. I'm going to turn it over to William to talk a little bit more about our product.
In addition to creating a product that is environmentally friendly and healthcare industry approved, Securus has designed its product to offer the most user-friendly experience possible. Through its studies and research, Securus has determined that meeting this requirement means that it is simple to access, simple to store, and simple to use. In an effort to be simple to access, Securus has partnered with CVS, who is currently the largest pharmacy in the US. In order to be simple to store, Securus has built its product right into the bottle. Securus understands that people lose things, especially small items that are regularly shaped. That is why Securus has created a custom pill bottles to store solution. The custom-built bottle not only serves as a storage device, but it also has the mixing mechanism built in. This allows the consumer to use the solution by just adding water. Securus's main competitor at this point is DisposeRx. DisposeRx offers a similar dissolving solution, but a much more cumbersome delivery method. Unlike our product, DisposeRx requires a consumer to separately purchase its pill dissolving solution. For now, it will be available at Walmart pharmacies, currently the 4th largest pharmacy in the US. DisposeRx also requires the consumer to open and pour solution from a separate package into the pill bottle in order to use its solution. With Securus, there is no separate purchase, no separate packet to keep track of, no opening, and no pouring. Just add water and shake. That's it. Now I'll turn over to Taylor.
Thank you, William. So the market that Securus is targeting here is predominantly those retail level pharmacies. The top 13 retail establishments in the United States that sell prescription drugs have a combined total of over 53,000 stores. The top 2 retail establishments, CVS and Walgreens, have a combined total of almost 18,000 stores that sell opioids. Both CVS and Walgreens are now potential strategic partners for Securus, and both companies have reported increased revenue over the past several years. According to the IQVIA National Prescription Audit, the prescription drug industry dispensed 445.3 million prescriptions, representing a total invoice spend of $450 billion in 2016. The most dangerous of these medications being opioids, with 215 million prescriptions being filled in 2016. The data analyzed by the CDC shows that 61.8 million patients receive those prescriptions, or 19.1% of the US population. We believe that based on this data, the retail pharmacy market is robust enough and stable enough to not only enter, but also to profit from. Since our product is directly tied to those opioid prescriptions being dispersed, we can safely estimate the potentials of our product lines. Now I'll turn it over to Adam to discuss our financial plan more.
Thank you, Taylor. Securus has built a very robust financial plan, perfectly in line with other startups of this similar nature. We're looking for approximately $500,000 in venture capital input during our first year to cover several expenses. In addition, our owners, our two founders, expect to inject approximately $53,000 or 47% of the initial $112,000 we'll need during year one. We'll also look to pursue approximately $25,000 from outside investors and a $20,000 commercial loan, which we'll try and attempt to get the lowest interest rate possible to minimize our expenses. Of that initial $112,000, this will cover our first year salaries, insurance, legal fees, rent, utilities, and give us enough cash on hand for working capital that we'll need. We've planned for approximately 3% increase each year of these expenses. Our first year, we're looking at selling 1.2 million units sold. We plan to grow this exponentially over the 5-year period. Next, we'll talk about our cost of goods sold, which is approximately 14 cents in total. Our bottle cap will cost approximately 12 cents, and material for each cap will cost approximately 2 cents that goes into each product. We're looking to sell this for about 50 cents total retail. Our contribution margin will be 36 cents based on this model, with year one total fixed expenses at approximately $806,000. Based on these figures, Securus will need to sell 2.2 million units in order to break even, which equates to approximately $94,000 monthly or 1.2 million annualized, which based on our financial projections, we will make profit in year two. At this point, I'd like to turn it over to Diane for our conclusion.
Thank you, Adam. So in conclusion, there is a significant space in the market for Securus, with minimal barriers to entry in place by competitors. Securus can rapidly gain significant market shares by partnering with pharmaceutical manufacturers. Additionally, by pursuing legislation that mandates the use of opioid remediation products, Securus can ensure that the product becomes an integral part of the prescription drug process. It is vital that Securus develop long-term relationships with large drugstore chains. It will also work with state and local officials on development of new regulations and possibly create a series of PSAs. Securus will partner with states, counties, and law enforcement, fire departments, and community groups and healthcare organizations in their effort to educate and distribute the product to surrounding communities. And that concludes the presentation. Thank you.